Hello everyone, Dr. Eaves here, Southwest Brain Performance Centers. We're going to be talking about sports injuries, or some of the most common injuries that we see. You don't have to be a quote-unquote high-level athlete to suffer from these. We see a ton of shoulder injuries, and it could be from throwing overhead, from reaching behind you in the seat, from grabbing something and moving it on a shelf, to just picking something up. It can be damaged in many different ways. I'll show you a quick little evaluation that I do in the office. Do this for me. To evaluate the shoulder. So we're going to evaluate the front, which is in my hand. Now we're going to look at the rotator cuff muscles. Push up into my hand. Push down into my hand. Right here. Pull that way. Okay. Put your thumb down. Push up against me. Good. Like that. Against me. Okay. Hold right here. Thumb up. Push up against me. Good. Put your hand over your head. Good. Bring it down. So you can see it has good range of motion there. None of her rotator cuff muscles are weak. The biceps tendon isn't weak. We see a lot of times that bicep tendon will pop out. And how do we adjust it? Go ahead and stand up for me. So if I thought the shoulder was healthy and we could adjust it and there would be no issues, then we would come in very simply. Just relax it and adjust. And a lot of times the clavicle is involved, so the clavicle runs from here and it comes out to the shoulder. And when the shoulders are rounded forward, it causes a lot of pain right in there. So what you can do, come in. I'll come in right here. Just pull it in. You get the clavicle, so it opens that up. And then also we adjust the ribs too, because you want to make sure the scapula runs on the ribs. It protracts, retracts appropriately. So just relax. And then we would go back and we recheck all the muscle testing to make sure that it was stable. And the knee is another very commonly injured area. So you can look at it several different ways. Probably running is probably one of the most common that we see. Jumping rope repetitively, riding bicycles. You see a lot of pain in the front of the knee right here. So a quick little evaluation. Come in. Okay. A little bit higher than we want. Just relax. Cool. Good. Good. So hold right here. Palpate. Tubular head. Any pain right here?
No.
No? Any pain on the inside? So a lot of times the kneecap doesn't track very good, and we see an imbalance in the muscle tone on side to side. So this is the TFL out here, comes up, and then we have the adductors in the middle, and then we have the quads right here. So what we can do is push into my hand. Good. Pull down to the table. Good. Any pain with any of those? No? Okay. Any pain right there in the front of the knee? No? So if we evaluate the knee and we don't think there's anything going on, nothing structurally, mechanically going on, we can adjust it a few different ways. But my favorite, come in right here behind the knee. Nice little thrust right there. And it feels fantastic. So that is just one way that we look at the knee, but we also do soft tissue work. But one of my favorites is a compression wrap. You might have seen these on some of our other videos. Come in, and the knee for me. And wrap the knee. We've had patients come in with knee issues, and we do this one therapy, and it's a minute-long therapy, and they've had pain for years. We do this one time, and it completely take away their pain. It's pretty amazing what this wrap can do. So what it's doing is really loosening up all the muscles around the joint, opening it up. So I do this for about a minute and a half. Take this off. And should feel like a new person. So that's if you have an injury in your low back, one of the most debilitating things out there. There's several ways that chiropractors look at the back. I will just show you a few tests, just very simply, of what we do when we evaluate it. Any pain? No. Any pain? No. Any pain? Any pain? Okay, lay on your stomach for me. You gotta come in, the low back, you gotta palpate, we gotta make sure there's more or less tone on one side or the other, make sure there's not any spasms or anything going on. Lift this whole leg up. Don't let me push it down. Good. Lift this whole leg up. Don't let me push it down. Good. I'm going to push in on your side. Any pain in the low back? Nope. No pain in there. Okay. Next thing we do. People have low back pain, and a lot of times it doesn't start in the back. So they'll say, it hurts on the side of my hip, in my glute, or in the back of my leg, but it doesn't start in the low back. So one of the things that we do is look at the piriformis, and it's a muscle and it stretches right across here, and a lot of people say, I got my sciatic pain is acting up, and it's really this muscle, so we can evaluate it in different ways. We'll come in and test along the belly of that muscle. It can be pretty painful, and a lot of times if we find where the issue is, it'll shoot pain to the back of their knee. And this is actually the therapy too. So along with adjustments, this is one of the things that we can do for that muscle in this low back. Okay, lay on your side, face, two. Another thing we can do, again, straighten your legs for me. Lift this leg and relax it back. Relax it there. Push straight down. Tell me if that causes any pain. No pain? Okay. Sit up for me. Face the wall. And then we'll come in and we'll feel the low back. We'll check the joints and see the integrity of the low back. Just making sure everything's nice and healthy. Okay. Go ahead and lay on your right side, just that way. And how we treat the low back is we do what's called a chiropractic adjustment. So we'll go in and find the joints that aren't moving very well, and we do a light little thrust, and you might hear a little click, and you might feel a release in your low back. That's the muscles relaxing. Okay. Just scoot towards it. This one, got this elbow. Come in, the low back. What the problem is, nice little adjustment, just like that. Again, when you come in and do an examination here, we do a lot more in-depth neurological and physical examination than that, but that's just a quick way that we address and look at sports injuries. We find these little small tears in people's shoulders. We've helped so many people with rotator cuff injuries that are very minor, but they're chronic, they stay there for a long time. And we find it with ultrasound. So we do a little diagnostic ultrasound here, and I'll explain how it works. So say she came in, she has pain right here on the side of the shoulder, rotator cuff. What we'll do is actually, for a diagnostic ultrasound, we turn it up. And in this instance, it's at 2.0. So what we'll do is we make these little small circles, and we stay around where the rotator cuff inserts into the glenohumeral joint on the side. and the greater tuberosity. So what we find a lot of times is the patient will, after a few minutes at full strength, they'll say, "Ow, that hurts right there," and it'll be like a deep ache. And what we do is we come to the ultrasound machine and we'll turn it down. So say she had the pain, and I'll turn it down to 1.6, and I'll stay on the shoulder a little bit longer. And say there's no pain, and a few minutes go by, and she tells me, "Hey, the pain's back, it's right there." And if the pain's above a 3 out of 10, we typically use that as our scale. If it's a 4 or 5 out of 10, that's too much pain. So say that she's in pain again, it's a 5 out of the 10. So what we'll do is come down, and I'll turn down the ultrasound even more. And we'll keep going until she doesn't have any pain, or if it's below a 3 out of 10. And whatever that number is, that's how we'll start her therapy the next time. So what that means is she'll come in for an 8-minute therapy, we'll ultrasound her, and starting at 1.3, and we'll work our way up. So then we'll go up to 1.4, 1.5, until she's at 2.0. And if she comes in and she's at 2.0 for 3 sessions in a row, we know that that little micro tear in the shoulder is pretty much healed. And then that's when we start doing more of the active therapies in office. So again, this helps all kinds of shoulder injuries, mainly those chronic small little tears. We find them with the ultrasound, and we use the ultrasound as the actual treatment. One of the things that we do for shoulder rehab here in the office is we use a motion guidance laser as therapy. So you see it on the back here. She's going to trace it with the laser, different patterns to re-educate the muscle and how to move it. You get the visual feedback of the laser, so if she falls off the target, she'll get that error signal saying, "Hey, you went too far this way or too far that way," and it's fantastic for rehabbing the shoulder. Let's go ahead and do that tracing I just showed you. So she's nice and stable right here. Scapula's retracted. Go ahead. A little bit slower. So again, this therapy is fantastic for shoulder injuries. Really feeds back to the brain and lets her brain know, "Hey, this is how I need to move the shoulder the right way in space." And the good thing about this therapy is it's non-weighted, so there's very low risk for injury. Very quick little therapies. It doesn't take very long to do that.